Okay, top 10 reasons why we're here tonight. Number 10, because we need to show support for public option.
Yes.
Number 9.
Number 9.
Because we need to show support for one another.
Okay. And number 3, because we've been waiting too long.
Well, that's what we're getting there, babe.
Number 8.
Number 8, because we need to be the voice for the people who could not be here tonight.
Yes.
Number 7, because we should love and care about our neighbor.
Yes.
Number 6, because we live, even Republicans, because in a civilized society, health care is a right, not a privilege.
Yes.
Because people are more important than any flag or any ideology.
Yes.
Woo! Because we need to hear one another's stories.
Right.
Number 3, because we need to show we truly do value human life.
Yes.
Okay. And number 2, because we need to be the change we want to see.
Thank you, Gandhi.
And number 1, to honor Senator Edward Kennedy's tireless efforts. And in his words, the work goes on, the cause endures, the hope still lives, and the dream shall never die. Okay, we're going to have some folk come up to tell some stories of folk. Mike, would you come up first? Mike is going to read a story. Real people, real help.
Riverside, California. My daughter was attacked by a dog. We had insurance, so I took her to our provider's hospital. After she was worked on and healing, I received notice from the insurance company that they would only pay a small portion of the cost of her surgery. Apparently, the doctor that worked on her was not a doctor with our company. Even though I was at our insurance company's hospital, I petitioned for a reconsideration. And even the doctor wrote to the company explaining that there was no one else available at the time to do the emergency surgery. But they still turned us down. I had to pay $4,000 out of pocket at a time when my income was $7.50 per hour.
That's wrong. Okay, this story is from Brandon from Louisville, Texas. At 55, my mother was hospitalized due to a staph infection and its effects on her body. Because of her insurance, she was transferred to a long-term acute care facility where her doctor said she should stay until she recovered. After 30 days, the insurance stopped paying for the care facility and she was transferred to a nursing home that was not equipped to take her in. She was hospitalized again and soon fell into a coma from a urinary tract infection from the catheter she had to use. If her insurance would have paid for her to stay in the long-term care facility, she might still be with us today.
This story is from William from Chicago, Illinois. My wife started her own public relations firm and was doing so well, I quit my job and joined her. We bought insurance coverage personally, not through the business because we were so small, but it did us no good. Every claim we made was denied because they called everything a pre-existing condition. Eventually, we realized they would never pay for anything. So we gave up our dream of expanding our small business, and I went to work for a university just so both of us could have health coverage. We have a fine life and good careers, but our firm never got big to the point where we could create a bunch of jobs and hire people, which was what we really wanted to do.
This is a story from Lauren from Tulsa, Oklahoma. I just lost a corporate job that I had for 21 years. Shortly after being laid off, my husband developed arterial fibrillation, and doctors discovered that he had a blockage in one of his arteries. They installed a stent to remedy the situation. We opted to go with Cobra in order to stay insured while I continued to look for another corporate job. I have yet to find another job, and our Cobra runs out in mid-October. We have checked with at least 10 to 12 insurance carriers and have been told that no private insurance company to the stent and his heart condition. He takes many medications to keep his heart as healthy as possible, and it is quite expensive. He is 61 and I am 53. It's tough competing in this job market right now, but if I don't find a job soon, we are in serious trouble.
In 2002, when I was 55 years old, my husband and I decided to finally buy our own dream house. We bought our new dream house, which cost us $240,000 in New Milford. As soon as we got our house, I had emergency surgery, a perforated bowel. I had no insurance. I couldn't get it because I was pre-existing condition, so I couldn't get any kind of insurance whatsoever. I was rushed to the hospital. I was in surgery for 13 hours the first time, and then the second time for the surgery, 13. The hospital went to court right away, and they liened my house for $72,000, all because I couldn't get life insurance. I have a $72,000 lien on my house, plus other liens for the anesthesiast and all that. Well, thank you to the government, and thanks to all the insurance companies who wouldn't help me. I am trying to pay these lawyers off. I'm being sued by all of them because they want their money, even though the lien is on the house, all because I couldn't get health insurance.
I had health insurance for 22 years and didn't know what I had until a marriage ended, and then I was stuck without insurance and struggling with work. And I finally, after advocating at my job for about a year to get health insurance, I finally got it, and 1 month later I had a major diagnosis with major surgery and major things happen. And I would be bankrupt today if I did not have that. And still, even now, I went to my doctor and I said, and my doctor ordered a blood test, said just to see on an overall scale how you're doing. And the insurance company denied that blood test because it wasn't medically necessary. I said, don't you want your costs down? Wouldn't this help you? No. This is out of pocket. That was $200 I wasn't expecting that month, you know? So I'm sharing that because I just was stunned when it started to happen to me and my friends. It was like, whoa, big wake-up call. So we really got to keep talking.
Thank you, Mary.
Calling our congressman.
All these stories that we're hearing now are very intimate and very personal. I don't really have any that I can tell about my own personal problems with any personal health problems that I can relate. However, I do want to relate, and I want to speak on behalf of the employees that are working in the medical health field. And these are employees that I meet on an everyday basis. An intern that works with me that's working 80 hours a week, that is overworked. What kind of effectiveness are we getting out of these people? Doctors that are straddled with high malpractice insurance and a shortage of primary doctors throughout the country. That is a known fact. So the healthcare system and repair of it is not only for healthcare for everybody, it's quality healthcare. I talked to a lady who works as a cardiac, she reads the readings from echo specialist, yeah. She was telling me she works 58 hours a week. There's got to be regulation on this so we can all have healthy insurance, quality insurance, and affordable insurance. Thank you.
This is just a word. I'm a healthcare worker. I'm a family therapist. I cannot tell you how many people that have health insurance are getting denied, getting their benefits cut. And it's awful when you're working with mental health. How sick are you supposed to make somebody so that their insurance company is going to pay the benefit that they're paying for? My son is a medical doctor. He's a neurologist in New Hampshire. He can't wait till this system gets fixed. He has 3-page letters to make sure his sick patients get the medicine they need, maybe the non-generic or the generic brand, and tests that they need. My youngest daughter is a student at MIT. She lived in London for 6 months. She worked for the National Health Service. Mom, guess what? They're not dropping dead in the streets over here. They have great health care. She got sick going to work one day, and they said to her, Kim, what are you doing here? You're sick. Go home until you feel better.
Yeah, you don't hear
Would your
that around
employer,
here.
would any employer in America, they're going to say to you what? When are you coming back?
Yeah, right.
Wouldn't they?
Oh, yeah.
There is nothing to fear.